Uh, Jing Li received a PhD in pharmaceutical sciences from Wayne State University and completed her postdoctoral training at the University of Nebraska Medical Center. For the past 5 years, Jing has worked in Streck's Research and Development Department, focusing on the development of new stabilization technologies intended for liquid biopsy applications. Her talk today is titled Reliable Results, How Proper Sample Collection Can Transform Your Assay Accuracy. Jing?
I would like to thank Luminex for the invitation. It's such an honor to be here today, and it's been a great day. I learned a lot. That is really cool to see how xMAP technology has been used in biomarker discovery and clinical assay development processing, all kinds of different fields. It's very exciting. So as the last speaker today, I would like to switch gear a little bit and start talking about how proper sample collection can actually transform your assay accuracy. So for those of you who are not familiar with Streck in the audience, we are a biotech company nested in Omaha, Nebraska. We provide quality controls and sample stabilization solutions that give you confidence in the validity of your results. Our quality controls include hematology controls and molecular controls that's being widely used in all clinical labs around the world. And our sample stabilization products mitigate the pre-analytical variables in critical samples and easing the handling concerns and allowing for batch processing. So some of you might know Streck because of our cell-free DNA BCT, which was launched about 15 years ago, and now is widely used in liquid biopsy for single or multi-cancer detection. We have expanded our product portfolio since then, and today I'm going to focus on the newest member of our product line. And basically, I'm going to present you with this tool that hopefully, just like the Luminex xMAP instrument or technology, you might consider to put it in your toolbox when you analyze circulating proteins. So I don't need to basically educate this group that circulating proteins in the blood are very important biomarkers. Basically, throughout all of the talk today, we basically cover all of the hot topics, the Alzheimer's diseases, the cancer, and basically the cytokines are used in are cornerstones of any diseases that involves inflammation. But circulating protein analysis are pretty challenging. So there's more than 10 log span in the protein abundance. So with a good assay, you need to be sensitive enough. You need to have like a wide dynamic range that cover the lower end and the higher end, and also tight CV as well. And then protein actually, the plasma or serum protein has a very varied stability just because of their different structure, their different post-translational modifications, and their different tissue or cells of origin. And when you think about blood, blood is actually a very complex matrix. So in 1 microliters of blood, so you have 4 to 6 millions of red blood cells, 4 to 10 thousands of white blood cells, and 150 to 450 thousands of platelets. That's in 1 microliters of blood. And when you think about it, that's a lot of cells in the blood. And all of these cells contain a lot of proteins. And when you collect a blood sample, when a blood sample basically leaves the in vivo environment, and then some ex vivo changes will happen in that tube. So when you develop an assay, I know a lot of people started with everything under very well-controlled environment, right? So if you are a bench scientist, if you're a good one, a lot of you are perfectionists. As we can see, you want to see every single step, in perfect, well-controlled process. And then a lot of people, I see a lot of you nodding here, you want to go home and feel like, yes, I did not make any mistake today. Everything went well in my 55-step protocol, right? But then, in real world, when you actually translate those, assays in real world, in clinical labs, you will face some challenges because in the real world, nothing is well controlled and nothing is perfect. So for those of you who are not familiar with the laboratory workflows, so basically for the total laboratory test process, it includes 3 phases. So there's pre-analytical phases, 3 pre-analytical phase, analytical phase, and post-analytical phase. So the pre-analytical phase where the doctor orders a test and the sample gets collected and processed at the collection site. And then if the sample needs to run at a centralized lab or location, so the sample needs to be transported. And then after arriving at the testing site, there is additional sample storage and processing that can happen. So in the analytical phase, so this is the phase actually your sample is being run, right? And then in the post-analytical phase, so there is data analysis and data are interpreted by the physician and then returned to the physician. Return to the patient. So advances in instrumentation and automation have minimized the analytical variables in protein analysis. We've heard all good stories about the Luminex technology, a lot of the automations that's being putting effort, and also experts from the Luminex Explore Lab, right? And then Heather in the audience that put a lot of efforts for controlling or minimizing these analytical variables. But what about the pre-analytical variables? There is a lot of things that can go wrong. So when the sample is collected, you have to think about, is it serum, is it plasma? If it's plasma, which anticoagulant do you use? Do they have different baselines? And then during the processing, which spin protocol do you use? And then after that, when you're doing the transport, do you use ambient shipping? Do you use cold chain shipping? Is it frozen? Is it refrigerated temperature? And what's your shipping packaging? And then after the sample arrives at the testing lab, is there any different freeze thaws that your sample allows, right? And then is there any additional storage? How tolerant is your assay, to adopt all these variations and changes? So a lot of the errors and variation can be introduced in the pre-analytical phase. And then according to a lot of very known publications, the pre-analytical errors actually account for 60 to 70% of all errors in sample testing, because there is a lot of human errors can be introduced. So today I'm going to focus on 3 major aspects on the pre-analytical variables that may affect your assay accuracy. So these top 3 are the ones that are related for protein analysis. So the first one is the ex vivo platelet and leukocyte activation at draw time. So as I just introduced you before, there is a lot of platelets in 1 microliter of blood. There's almost 500,000 of platelets in there. And then all the platelets actually have very important function in hemostasis, thrombosis, inflammation, and angiogenesis. And then when platelets has 2 different status, they have resting status and activated status. When they're resting platelets, they just look like round normal cells. And they have these granules, remain intact in the platelets. And then the granules have alpha granules and dense granules, have a lot of proteins and contents in them. Once they're activated, the morphology changes immediately. You can see this extension of the membrane, and then they have these arms stretching out. And at the same time, that simultaneously, that happening along with the morphology changes, a key event is those granules translocate from the center of the platelets to the membrane and release all the content. So as you can see that, and these content are not just thrombosis mediators that recruit more platelets to facilitate the clotting process, but they also include a lot of important cytokines, as many of you can recognize them. So as you can see that, the platelets can be activated either in vivo, which can reflect the person's or a patient's either physiological or pathological status, or they can be activated ex vivo, in this case, in a clotting tube when you collect a serum sample. So when you collect serum sample, almost all the platelets are activated. And that's not the only problem, because once the platelets are activated, all the cytokines are released. They also affect on the local environment and affects on other cells and activates other cells like leukocytes, like white blood cells as well. So so this is we all know about serum, but many people actually don't know about this, that EDTA actually randomly activates platelets as well. This is actually very well documented in 1960s or 70s journals like Platelets, but protein communities don't read those journals. And the citrate-based anticoagulant, actually, such as ACDA, is known to minimize these ex vivo platelet activation. So here you can see that we can directly see the platelet activation under the microscope just from the blood smear. And then ACDA compared with ACDA, the platelet remain resting. And we try to also semi-quantify the platelet activation. So you can see that using flow cytometry of the surface marker, we have CD62 P for the activated platelets. So we can semi-quantify the percentage of activated platelets among all platelet population. So compared with the ACDA, these are all paired sample, paired donors, the same phlebotomist. You can see that EDTA has very large donor-to-donor variations. And how is that possible? That's why they call it random platelet activation from EDTA for a reason. So you cannot really control this. So to address this problem, we developed Protein Plus BCT, which is a whole blood stabilization tube for protein analysis. So the first question we ask ourselves when we develop this product is, does Protein Plus BCT limit the ex vivo platelet activation at draw time? So this is one of the studies. We got some help from the Luminex Explore Lab. So we collect the sample in Protein Plus and the same donor in EDTA and serum tubes. And we send the samples, we collect the samples, we process them immediately. Within 2 hours after draw, we send the frozen samples to the Luminex lab, and then they run our samples on the Luminex xMAP using Biotechnique's human XL cytokine performance assay, which is a 46 pan cytokine panel. And then so as you immediately can see that this is samples collected immediately after draw. Serum basically just sent out with much high levels of protein abundance that you can see. This is a sample of platelet markers, PDGF, PDGF-AA, AB, and RANTES. And then it's very interesting for like CD40 ligand and IL-1 alpha. So in plasma samples, these samples actually are under the lower level, under the lower level of detection or quantification. But in serum sample, they stay positive. And then so oftentimes when you read assay like IFU, and you always see serum has a higher range, right? And you wonder why, and this is why. This is because of contamination from the activated platelets. And then this is for the EDTA because it's random, and this is a smaller sample size. So for some of the markers, you do see EDTA has higher levels when you compare it with Protein Plus. And Protein Plus minimize the ex vivo platelet activation. And then this is a group of white cell markers. As I mentioned before, once the platelets are activated, they start this cascade, right? Not only just recruits, platelets, but also activates white blood cells as well. And a lot of these white blood cells, natural killer cells, neutrophils, macrophages, cytotoxic T cell, all of these cells are granulated. And they also contain a lot of cytokines as well. When they're activated, they started releasing stuff to them as well. So here you can see that, again, serum has the highest level because of all these white blood cells are activated and release all the content of these and then contaminate your sample. And then we also compare that with a lot of other traditional or conventional blood collection tubes, heparin and serum with the clot activator, and then different EDTA tubes, and some of them, the PP tube is with the gel separator. And we use a signature platelet marker, TGF-beta1, and a signature white blood cell marker, myeloperoxidase, basically to see just how different they are. And you can see that the baselines or the abundance are everywhere. And then so Protein Plus remain low for both platelet signature marker and the white cell platelet markers. So we talk about the ex vivo platelet and leukocyte activation at draw time. So the take-home message is the clotting process in the serum tube actually activated platelets and activates white cells. So all of these can introduce contamination of blood cell secreted protein in your sample. And then EDTA cause random platelet activation that can also introduce variants. And Protein Plus minimize both immediately after draw. So we tackle this problem. So the second problem we're trying to tackle is the blood cell activation and degradation during the whole blood storage. As I mentioned before, not all clinical labs have the luxury to process a sample immediately within 2 hours. So a lot of times samples are batched and processed by, before lunch break or are processed by the end of the day. Sometimes, if the samples are collecting during the weekend because we're short staffed, they're processed on Monday. We hear about these stories all the time. And then during storage, if there is a delayed processing, when the sample plasma is not isolated immediately after the draw, and they stay in the whole blood status for a very long time, you will see more platelet activation. You will see more white blood cells activation, and they start to die as well. And they will see red blood cell lysis. So all of these proteins start to release and further complicate your sample. So we first, and then we test, we ask another question, does Protein Plus BCT limit blood cell activation and degradation during whole blood storage? So we conducted a couple of other studies. We collaborate with Luminex Explore Lab. So we collect a sample in Protein Plus BCT, EDTA, and ACDA tube, and then to mimic the real-world situation, we put the tubes in whole blood at ambient temperature for 3 days, 5 days, 6 days, and we separate the plasma at day X, and together compare with the draw time sample. We send them to Luminex Pro Lab, and they run the samples. We tested on 2 different assays. One of them is the Biotechni's discovery panel, basically from their 350 whatever. I don't know exact number. I think 350 is just what you mentioned. From their menu, we cherry pick the top, the key cancer markers and immuno-oncology markers. And then we group them into an 8-plex, 16-plex, and 32-plex. And then we also test their cytokine panel as well. So this is the results, and we're really happy about it. So this is a couple of really key cytokines or protein markers that are very clinically relevant. We have HGF, IL-1 beta, IL-8, VEGF, CD40 ligand, BDNF, TGF-beta1, MMP9, just as a few of the examples here. As you can see that at EDTA samples and ACDA sample, at draw time, they remain fairly low level, but after 3 days and 5 days, the amount they have just show the market increase. While in Protein Plus, they start low and remain low. And then for some, TGF-beta1 is just my personal favorite marker. As you can see that the EDTA at day 0, you already can see a lot of the elevation immediately at draw as well. And then when you look at these 55 different markers globally, so we look at the mean fold change from day 3 or day 5 when they compare with draw time. And then each individual dot represent a single protein. So we were really happy to see the results. When it compared with EDTA and ACDA, when you see this large spread, Protein Plus with the 55 different markers, it remained pretty tight. We have some of them are having 4-fold differences, but compared with the EDTA, that's probably around like 100-fold differences. So it's in a very much well-controlled and show a lot of greater stability over the conventional blood collection tubes. So this is another data set on the 46-plex cytokine panel. We see very similar trend because cytokines are much more challenging than a lot of the traditional cancer biomarkers as well. So the take-home message here is a lot of more cells are started to degrade, and then not just platelets, white blood cell, red blood cells as well. And then they start to releasing more of these blood cell secreted proteins into the plasma and can further complicate your assays or protein analysis. And Protein Plus BCT maintains draw time concentrations of proteins of interest during the ambient whole blood storage for up to 5 days. And of course, it will depend on your protein. So now we talked about what can go wrong immediately after draw, and we talked about what can go wrong during storage. but there's more. So I'm going to talk about 3 little aspects about how there are some other pre-analytical variables, such as processing or storage conditions, can also affect your sample analysis. So 3 things include spin protocols, freeze-thaws, and temperatures of sample storage. So at Streck, we always recommend double spin protocol when you collect blood and process your plasma, and there's a reason for that. So after the second spin with a higher speed, you will see, just visually, you can see much cleaner plasma sample. With a very minimal residual platelets, with a very minimal cell fragments in them. But we completely understand in clinical labs, double spin can be time-consuming. So we also tested a single spin here. So although we still recommend double spin, but we still see that Protein Plus shows a lot more benefits when you compare with EDTA, even it's a single spin. And then the other thing that I want to make, the other point that I want to make is a lot of, when you read some of the essays, and then you can see, oh, collect platelet-free or platelet-poor plasma, which means they use the double spin protocols to further clean the residual platelets in there. But as I mentioned before, the platelet activation happens immediately after the draw. And this is a very irreversible process. When the proteins are released, they're released. So even when you process the EDTA using the double spin protocol, you still see higher values or abundance in that proteins of the platelet marker. And the second thing I'm going to talk about is the freeze-thaws. So with protein analysis, we often say, oh, avoid multiple freeze-thaws. And then when you process your sample using single spin, you have a lot more residual platelets or residual cells in them. And then when you freeze-thaw multiple times, that will cause problem and further release these proteins from the platelets to your sample. So as you can see here, with EDTA sample, we definitely recommend double spin and then minimize the freeze-thaw. But with Protein Plus, it actually can survive up to 10 different freeze-thaws. So again, this is one of the markers we tested. We have a lot of other big studies ongoing. Hopefully, we can show you the results soon. And then last but not least, I want to talk about sample storage temperatures. For this product, we always recommend, after you collect your sample, put them in ambient temperature storage. Don't put them in the cold refrigerator. Don't expose them to a sous vide environment, right? Don't cook your blood, basically. Don't expose them to 37-degree incubators. But we do get asked from our customers, can we put it in the refrigerator? Can we put it in 37-degree incubators? And our answer is very simple. It really depends on your protein of interest. So for example, in TGF-beta1, my favorite, actually Protein Plus, it doesn't matter of the different temperatures. EDTA is very interesting. You can see this bell shape. But we believe at 37 degrees or 30 degrees, the protease activity actually outpowers the contamination. So you will see protein degradation when you put them at higher temperature. For the signature myeloperoxidase marker, which is a marker for white blood cells, and you can see that they don't really like cold temperature at 2 degrees or very high temperatures. So you can see that the mid-range spot is what we really recommend you store the blood samples. And the other thing is looking at hemolysis. So this is we directly measure the absorbance using the nano. As you can see, again, room temperature ambient storage is a sweet spot for controlling the hemolysis. Again, we have bigger studies ongoing, and hopefully we can show you more results on more of the proteins. So take-home message here. There are a lot of pre-analytical variables, and they are very, very important. So when you validate your assay, when you develop analyzing your data, you want to make sure that when you receive the sample, you're confident, right? And then Protein Plus BCT basically provides a lot of the flexibility in sample storage, batching, processing, and shipping. It simplifies the pre-analytical workflow before your protein analysis and ensure your sample integrity. So this product is actually was launched this year at AACR in April. So if you're more interested in more of the technical details and then how to order them, please visit our website. And if you're interested in working with us in assay development, our business development team is here to support you. If you haven't talked or met with Agnes, who's sitting in the audience here, please wave. Please talk to her, and during the happy hour, we're happy to work with our assay partners. With that, I'm really happy. I want to thank Bobby and Luminex again for inviting me for this talk. It's been a great pleasure to be here with you and connect with all of you. And congratulations for a successful event.
Thank you, Jing. Great talk. Any questions? Oh, yes. Sherry.
So I noticed when you were showing the data for the single spin versus the double spin, so the single spin was a lower speed and a lower time. So
Yes.
kind of talk about what led to you doing, instead of doing like the first, in the
Just
double
the
spin, the
first spin.
higher, doing
so
the
this-
higher time and
Yeah,
higher
so
speed.
the single spin protocol, basically what we notice are either partners are using basically follow the BD tube, the IFU. So all of our,
So it
conventional
matches
EDTA,
what
so it matches
what they're
whatever
doing already
actually
in the
using
clinical
already
lab.
using
Gotcha.
a EDTA tube.
Okay,
So.
yeah, I just wondered about that.
Sure, thanks.
Any questions? Yes, I'm coming there, Randy. Always Randy. Sherry and Randy.
Keep them going.
So, Jing, you know I'm a huge fan of what you guys are doing. For years, people have talked about pre-analytical variability. They've talked and talked and talked, but it seems like no one's done anything up until you guys actually tackling this problem. Are you guys seeing a good uptake from the industry, that people that recognize this is a problem or it's an issue they've kind of swept under the rug for many years?
Yeah, so I think there is a very clear group. So when we talk to people, there are people that clearly understand the prenatal variables and platelet activation that involves in a lot of these markers. So sometimes you walk through posters like, oh yeah, I'm studying MMP9. Oh my God, the biggest issue is platelet activation. And then we don't know how to control this. And then we have other group of people that have no idea what's going on. And then they're not aware of, especially they do cohorts from, like biobank samples. They use serum, they use EDTA samples, which they have no idea how those samples are collected or how long it's been collected, basically, they have no idea how the sample integrity. So they put these, great studies and very expensive testing. We all know proteomics analysis are pretty expensive, right? So it's like they put them in these expensive analytical assays. And basically, when you don't have a good sample, it's garbage in, garbage out.
Yeah, I've always wondered how many cohort studies the difference is sample collection protocols for cases versus controls.
Yeah, I think some people are aware of these, variabilities. They actually taking a different route. So when they discover these, biomarkers, they try to collect, samples from different clinical sites, and then basically remove all those biomarkers that are, more prone to clinical variables or blood cell degradation. So just like the top, 10 cancer markers, they are very stable cancer markers. So, they're, you can, collect them in EDTA, you can collect them in serum. They correlates very well. So that's how they select their biomarkers. But I think that's why I mentioned in the beginning, I hope I present with you a tool that hopefully can expand your portfolio of analytes that, maybe cytokines can be one of the, can be rising as a more robust, analytes for diagnostic or disease monitoring as well.
It's very useful talk for us. I do have very detailed cytokine database on website we can check. Useful cytokine database, the information on your website
There are some
we can
literatures.
use.
I can definitely forward it to you. That's
Okay.
And then I think a lot of the I think who do I talk to earlier? I think a lot of the companies are aware of the biotech companies. When you read their assay, they actually kind of give you a warning sign that say these protein 1, 2, 3, 4, 5 are present in be cautious or something. So a lot of these information actually you can find in the literature.
Jing, we got one more last question.
Awesome.
Do you anticipate any impact of the collection on the antibodies, especially for immunoassays?
I'm sorry.
On antibodies?
Oh, antibodies. This is, yeah, another areas we haven't explored that yet. So thank you for asking that question. So you mean the antibodies like in the blood as a analyte or the?
It's like for vaccine like studies, basically.
We haven't tested them yet, but we're
That'll be
looking forward to.
interesting.
Yeah.
That'll be interesting.
Yeah. Thanks for asking.
Okay. I will make one more question right here.
Such an interesting talk. I really like it. What are your thoughts on the dry blood spot? After COVID, so many people are collecting the blood on the protein card. Do you think preclinical variable can affect that one as well? Because it's just simple drying.
Yeah, so the dry blood spots are actually used in a lot of spaces, like we see proteins, and it really depends on the assay and the analytes you're looking at. So if you're looking at total cellular proteins and there are so many proteins that are very stable, like they're stable for months. It doesn't really matter. So for those, actually, you can definitely use dry blood spots for that. But then for cytokines and all these things, first of all, you need the venous blood for those testing, and then the second, these are more prone to variables.
Thank you, Jing. Really appreciate it.
problem.
Thank you.
Thank you.